Consumer Health Data Aggregator Challenge Winners Webinar. The main item on our agenda today is to hear from the 4 companies that won our Phase 1 of the challenge. We're going to start off by with me giving a brief overview of Phase 1 of the challenge. Then we will hear from Dinesh Sheth of Green Circle Health, followed by Gustavo Javier from HealthCentrix, then Panha Cheng from Medyear, and Ken Foster from MetroStar Systems. And then we'll wrap up with me giving a brief overview of Phase 2. Can people see my screen or the slides?
So Adam, I can see your screen and everybody else is on mute.
Okay, great. I will take that as a yes then. Okay, so the Consumer Health Data Aggregator Challenge is part of the Connecting and Accelerating a FHIR App Ecosystem Initiative. And this was announced at HIMSS earlier this year by our national coordinator, Dr. Karen DeSalvo. So in the spirit of the open development of FHIR, we want to use a community-driven, user-focused innovation to build a stronger health IT system. So as we all know, the technology that can pull information from different sources and present it in a user-friendly way, and I'm really saying lots of different sources from lots of different places, it really is limited. And we feel that it's essential to involve the community and users. So the initiative is a three-part strategy involving 2 challenges and the Discovery Infrastructure for Clinical Health IT Cooperative Agreement, which was awarded earlier this year to Boston Children's Hospital. So this is one of the 2 challenges. The consumer side of the challenges is to, again, help consumers aggregate their data in one place under their control. This is something that has proven elusive and difficult to achieve. Clearly, there is immense value to people as they move between providers and systems and health plans to being able to get all their information and keep all their information in one place. And this is especially true for people that have to manage the health not just of themselves, but of family members, and also for anyone who has different chronic conditions or has multiple medications or has any of the or anyone who who basically isn't a young millennial invincible. The other challenge is the provider user experience challenge, whose intent was to enable innovative ways for providers to interact with patient health data. So the final requirements for the apps that we're looking for folks to develop, you can see these on the screen here. First is that they use the FHIR Draft Standard for Technical Use 2, or DSTU2. You might ask why FHIR? There are a number of reasons. Of course, FHIR is not the only open API out there, but it is one that has, we think, garnered the most traction so far in the developer and provider and vendor community, as evidenced by things like Project Argonaut. But of course, it's not the only one out there, and we expect other open APIs to develop further and become new standards. Next, we're looking for the apps to leverage data as specified in the 2015 edition Common Clinical Dataset. We want apps to demonstrate compatibility with different health IT developer systems that are implemented in production settings. Hopefully from at least one from the top 10 systems as measured by meaningful use attestation. Again, we want these apps to have been tested with users in production settings. And by the end of Phase 2, have them available through at least one of the following modes: the iOS store, the Android store, or direct from or available from the web. Again, in Phase 1, applicants were asked to provide mock-ups or wireframes of the app to describe the technical specifications, such as the security protocols and data flows, to provide a business or sustainability plan so that we have an idea of how applicants are going to continue to develop and market the app and bring it to the consumer marketplace. And lastly, to provide intents of provider partnerships so that they can go about with the testing of their apps. And so with that, I would like to pass control over to Dinesh Sheth from Green Circle Health. Josh, can we pass control of the screen and audio over?
Absolutely, doing that right now. Just looking for Dinesh in here. Panelist. Okay, Dinesh, I just handed you the ball, and you should be all set. Dinesh? If you're on mute, Dinesh, could you just unmute it? Maybe this is him.
Hello?
Dinesh, is that you?
I am here. Can you hear me?
Yep, we can hear you now. Perfect.
Oh, okay. Sorry about that. I don't know what was going on. And how do I share my screen with you?
If you just go to Share at the top and hit My Screen.
Tools. Let's see. Share. There we go. My screen. Perfect. Are you able to see my screen now?
We are.
Perfect. Well, thank you everyone for giving me time to talk to you for about 10 minutes this afternoon. So thank you very much. I'm Dinesh Sheth, founder and CEO of Green Circle Health. And I'm going to walk you through a little bit about what we are planning to do under this challenge initiative, what we have done so far and what remains to be done. So kind of a status update, as well as for those of you who are like me, not knowing each other from other companies, you may have just a little more information about Green Circle Health. So what we have and what this challenge came out to be, it's very complementary in nature. So when we started this company in 2013, we came out saying that we really want to build something to improve the health of millions of people and save billions of dollars in a healthcare cost. So with that goal, we looked everywhere to figure out where we should put our energy and resources to. And when this challenge came about, they came out with a line saying we want better health, better care, and better value, which seemed like exactly what we want to do. And hence we applied for the challenge. From our point of view, the problem we see, which all of you know being in this industry very much, is listed here on the left side, which are the higher growing cost all the time. Population as a whole is getting aging. We have lots of chronic conditions, 1, 2, or 3, depending on which age group you pick, that needs attention. And then on the other side, with digitization of health, we see a lot of efficiency gain taking place or will be taking place on the healthcare delivery side, as well as we see new drugs and treatment coming up. But we believe that all those efficiency gain in delivering what we have been doing for 100 years or many more is going to go only so far. And then when we start looking at corporate wellness side and looking at how they focus on employee wellness, again, we find that those were limited in scope. So with that in mind, we started building saying we really need to change the paradigm of healthcare from treatment to prevention. And if we look towards the prevention side, then we came around and saying we really need to bring family at the center of the healthcare so that family is engaged. And we thought that MU1, MU2, 3 had limited success in terms of technically it is there, but people like me who wind up with 28 different username and password from CVS to Walgreens to Hospital 1 to Primary Care 2 just weren't going there. We logged in at one time and then we didn't go back there. So we looked at something to be done there. And then, of course, we look at wellness and those programs and saying how do we improve the outcomes there. So with all those in mind, we assembled a team of number of people with first 4 that you look here, which are all seasoned executives who have been in building one or more companies before. And then we assembled a team of 15 sharp developers who can really start solving the problem and saying we can build something that is useful. And then we worked with number of consultants and advisors to come up with a solution. And the solution we built there and what we are proposing here are very paralleled in nature. So that what we are looking at is basically bringing the data from many sources, as Adam might outline, from different health systems, different technology providers, and then augment that data from devices that are evolving and using all that static data that exists in third-party systems, health systems, and your dynamic data, build a family dashboard that you can use for optimizing your own health. So, of course, we want to build this around the common clinical data set. So the data that comes from hospitals, laboratories, walk-in clinics, where have you, or the data you generate yourself at home can all travel together. So the question comes up sometimes is that, yeah, but that's why there were HIs built to exchange the data. And our position is that those were built for exchanging data from provider to provider, but for patients there was not much there. And we are changing here to bring the family at the center of the care. So with that in mind, we progressed here so far, and what we found is that we can build the user experience as we think is very desirable. Some of us have an experience building the solution that millions of people use in a consumer space. So we know a thing or two about that area. We can certainly store and forward the data that we collect. And we figured out working with healthcare provider that we can build the data and make it useful for them. So it is not just the data, because data and after a while becomes useless unless you derive meaningful intelligence out of it. And then, of course, we really got into FHIR implementation, and we said we can conquer that piece. So those 4 pieces we could do, we did complete those. And then when we ran into 2 orange red roadblocks, while in theory 9 EHR vendors have said that they would support this initiative, we are a little bit struggling, and I would like to hear from my other colleague trying to build the same thing and see what their experience is there. As well as we are working with some customer and we are seeing some roadblocks there. So towards the end, I would take a minute or so talking about that. So let me first show you what we are doing. So what we are building is a platform which allows people to really put all their lifelong medical history in a family profile, one place. And the key term here is family, so we are not working with one patient at a time. And second part we are doing is that we are augmenting that data with various vitals. And then we are bringing care programs, remote monitoring all together to make that information useful for them. And then, of course, components like teleconsult, secure messaging, alerts, reminders, appointments, all those become enhancement to that framework. So we have built, as we proposed, this much so far, which shows a dashboard for a family where you can see your data coming from various places, whether it is coming from an hospital or you self-entered it. And then you can do a lot of things with that data. You augment that data, track that information, whether it is your BMI because you are managing weight, or whether you are counting your steps or measuring your blood pressure. We built all this component, and that is possible today. Using that data, as I said, to make it useful, we can build the care management program. So again, these are both kinds, either self-manage. So you came from a doc's visit and you really are told that you now have diabetes, what do you need to do? And when you come home, you really need to start tracking things. This platform would not only bring that data and the lab results that you got from the hospital or your primary care provider or specialist, but also you build a program around that so that you are reminded to do what you are supposed to exercise, you are supposed to eat properly, whatnot. Or your doctor is a modern doctor who is on the part 2 of the challenge side and is willing to receive the patient-generated data, then we push around and give that data too. Incidentally, for those, Adam of course knows this, for others, we took part in both challenges, and so we are going forward with building both sides of the equation, saying this is what you need on a consumer side, and this is what you need on the provider side. So we work on both ends of it, even though we believe that initial adoption of this may become actually reverse and may take off on a consumer side before docs come around accepting it. So where we need help is how do we go about finding this wonderful 9 vendors who took the pledge that they are giving 9 out of top 10 their data under the FHIR standard and give you access, and then if you build it, will they come? So here is the status from our point of view. We found, and we worked with and search wide and deep, and we found that only 3 out of top 10 hospital system vendor and same 3 out of top 10 health professional vendor do have a test server set up where you can connect and test your FHIR interface. At least good news, Epic and Cerner are there, so you can find enough health system to run around the town. So we built the first 2 connectivity and test against the test server. Now we run around the town and we talk to the Epic clients. And so back to this second problem. So we tell them this is all built, we can give it to you, your patient can use it. And oh, by the way, in your market, we have found a person or employer who is willing to pay for this system for all their employees to use it. So you as a health system have no cost to do this thing, we would bring to you. Oh, by the way, and you also told us when we were working in the first phase that if we build it, you will use it. Now they are into the quandary that if that health system wants to open this platform, in Epic and somewhere somebody has to agree and pay for, and we haven't been able to discern that. So that is our next challenge. We are not giving up on it, but we are right now a gopher between the health system and the vendor to figure out how to move the data which exists, which patient owns, and the patient or their family are ready to take it in our platform, but we haven't solved this last piece. So hopefully ONC can put some leverage on these people to see other 7 people who took the pledge and haven't opened up their door. Hopefully they would open their door for us to get in, because doing one at a time was the original problem where we were doing custom interface to someone, and hopefully here we get through it. So that's my story, and I think I'm at the 10-11 minute mark, so I would not go into too far detail, but hope that gives you some view on what we are doing, and a lot more information you can find on our website. Thank you.
Okay, Dinesh, thank you very much. Next, we are going to move on to Gustavo Javier from HealthCentrics.
Hey, Gustavo, I just went ahead and handed you the ball, so you should be all set.
Hello.
Hello.
Can you hear me?
We can hear you now, yes.
Hello, everybody. Good afternoon. I just want to know how can I share my screen with you?
Sure. If you go up to share and then hit my screen.
Share. My screen. Wait a second, please. Share. My screen. Chapter 1, chapter 2. Yes. Okay. I don't know if you can see my screen now.
So we currently see a black screen. There we go.
Okay. You can see the presentation, huh?
We can see you.
Okay. Okay. Good afternoon. My name is Gustavo Javier. I'm a business developer in HealthCentrics, and I'm going to talk about Previ, our platform, and I hope you can understand everything I'm going to say. My English is not that good, but I hope you can understand, and thank you for your patience. So, what's Previ? Previ is a cloud-based connected health ecosystem where the patient is the information hub. He has access to all his medical information received from different health providers. As a patient-centered platform, families and caregivers can collaborate with the patient in order to help him to complete the care plan assigned. Besides, Previ's versatility makes possible the development of new services based on subscriptions. These services offer new revenue lines for physicians, medical practices, health systems, and so on. And for the users and patients, Previ is free. Just remark that HealthCentric is an American company where the founders, we are Europeans. We have developed different projects here in Europe, and we are developing 2 years this platform now. So, what does Previ do? Everybody is an actor in Previ: providers, family, and the patient himself, all collaborating together in the execution of the patient's care plan. And the patient interacts with every one of them too. In this example, we have a list of providers sending information to Previ, where this information is stored. Once this information is received, the patient decides who he wants to share this information with. In this case, he involves the family, and the family monitors and helps the patient to execute the care plans assigned. But not only that, the family can also collaborate in the care plans, updating, creating, and assigning new activities. So, as we can see, a family member can manage the health of the entire family using the different tools and services that Previ offers, such as PHR, care plan editors, metrics, timelines, video conference, etc., devices, and so on. And the result of all this process is a better and improved care coordination. How does Previ work? There is a lot of communication involved inside Previ, but basically we have 2 big blocks. The first one is how the information is sent and received, and the other one is how the information is shared. The providers send all the medical information requested by the patient using different technologies such as direct messaging, SmartFire, or XDS. Once the data is received and stored, the patient is able to consult this data and share this information with other providers or family or caregivers using the technologies of consent directive, security labels, or OAuth2 and UMI. The transmission and storage of this data is private and secure. We comply HIPAA, signing a VA agreement with all the providers, and we sign a privacy notice with the patient. So Previ meets privacy and security standards related to the transmission and storage of patient data. Previ's technology. Here we have a very simple picture about how Previ is inside, what technology is involved, and what we see here is that Previ is FHIR implemented on an IHI repository where the data is stored. This information is received and then is converted into FHIR resources using a CDA to FHIR converter. After this conversion, these FHIR resources can be then displayed in our apps or can be consulted by others. Previ is also able to interact with third-party EMRs using a smartphone FHIR. It can also interact with EMRs through direct, and it can also interact with HIEs using EcoDS. I'm not going too deep into these technologies because it's I think this is a very simple picture that shows how Previ is interoperable with any MU2 EHR and is easily implemented in the physician office environment. In the next slide, we have some of the functionalities that Previ has. As you see, we have the portal view and we have the app view. As you see, they are very simple, they contain a lot of information, and they're very easy to use and easy to understand. We can see that we have, for example, the PHR is a very extended PHR with a lot of information. The information we receive from that provider is stored and displayed in this PHR. We can consult this information. We can plan and create care plans through the care plan editor. We can check the adherence of the care plans. We can plan diet activities. We can use communication tools. We have a reminder. We have appointments. We have metrics, and etc., etc. So we have a very complete set of functionalities that helps the patient and the user to be monitored. What's our financial model? We have basically two revenue lines. The first one is from the doctors, and the second one is from the patient and the users. From the doctors, we get revenue from every revenue line Previ offers to the doctors. These lines can be programs such as Medicare chronic care management or remote monitoring, where the doctor receives a reimbursement from the services they are giving to the patients. And once the doctor gets this reimbursement, we receive a percentage of that money per month and per patient. And the other revenue line that we have with the users and the patient is through premium services or convenience services. For example, emergency PHI service and image storage services. So our Previ doesn't require any capital expenditures or long-term investment. The user pay only for the services they use and when they use them. So we have already 2 clients. We are starting giving service to 2 clients, and we hope to be out fully the next month. So we believe we are going to be ready with the full app for the next challenge, for the phase 2 of the challenge. So thank you for your attention. I hope you can understand what I'm trying to explain here, and good luck to everybody.
Okay, thank you, Gustavo. We understood you very well. Thank you for the overview. Next, we'll move on to Pana Cheng, I hope I'm pronouncing that correctly, from Medgear. And you will have to go to the Share menu and click on My Screen.
Okay, Pana, I just went ahead and gave you the ball, so you should be able to now share your screen. Hannah, are you there?
We can see your screen, but are not hearing you. Although we can hear somebody typing. Pana, your screen was up there, but we are not seeing it. And I'm not sure if you might be on mute.
Hannah, are you there? Nope. Hannah, are you there now? So Adam, she just sent me a message. She's going to try calling in again. Apparently there's something wrong with her audio.
Okay, thank you.
Hello, can folks hear me?
Yes, we can hear you.
Okay. Oh my God, that was crazy. Sorry, this is Panya Chang, the founder and CEO of MedYear. I'm going to share my screen now. There was an issue with dialing in to the meeting with WebEx, so apologies for that. So let's get started. 1 second. I have to pull up my screen. Okay. We're going to do a live demo and a video today. So thank you all for your patience, and thanks for listening in to MedYear's segment of this webinar. MedYear is elevating the healthcare experience for everyone. What you're about to see is MedYear 2.0, which launches October 26th at Harvard University. And then we'll also jump into a video demo of how we've integrated with the state of Michigan using FHIR. Since we're short on time, I'm just going to jump into the demo right now. let's see here. Okay. Okay, this is Medyear 2.0. In our home screen, we have a patient's feed. It's think Facebook, right? And you can add to this feed by adding patient inputted data, if you'd like. You can log which medications you're taking. This is good for adherence. You can log measurements. So like when your doctor says, hey, I need you to track your weight every week, you can do that. You can also upload photos of cuts, scrapes, wounds, and also if you've got paper records, you can take a photo of that and send it to Medyear. That's the patient side of patient-generated data. Here's your PHR component. It's the standard stuff from a CCDA, so one can view their labs. Here's their blood chemistry labs. Here's their latest lipid panel. If something's important, I can start in the top right, so it's now in my favorites, and I can come back to it later if I need to. Here's an up-to-date medication list, so on. We also have the ability for you to chat with your doctor. So take a quick look here. This is your doctor contact list. And you simply search for your doctor, add your doctor to the contact list. At that point, you can call your doctor, and if they have, if we have their direct address, you can send them a direct message as well, just like that, and include parts of your health record. Then, as you need to, you can create group chats with those doctors, right? And this group chat will then now put you into a private chat session with your doctors. And you can also share information as needed with those docs into the group chat. So let's say I want to talk about some of my allergies here. I can simply attach it to the chat, and there in the top is the chat I just created, so I would just put that into that chat. Now, I'm going to switch gears a little bit to Michigan and the statewide integration that we started and are literally a few days from completing there. This is where FHIR comes into play. Let me show you what we did. Hopefully the audio works here. This is a pre-recorded video of our integration with the state of Michigan. I'll let this other guy do the talking.
Hi everyone, welcome to Medyear's demonstration of our integration with the state of Michigan. This is Tanya Cheng, the co-founder and CEO. What you see on your screen here on the left is Medyear's mobile app, and on the right is Aggregator. We have a test user here, Michael Freeman, who has just logged in. Michael is a Michigan resident, and as a result, we can present him with the opportunity to have his current Michigan history and forecast displayed. Now, in this particular case, Michael is a fairly new Medyear user and has not yet opted in to integration with Michigan. So as a result, if he checks his current Michigan status, his history and forecast are empty. So listed in the top right, this is how you opt in. You can import your vaccine history automatically into your Medyear health records. Would you like to enable this feature? Well, of course we would. And so Michael is going to hit yes. And at that point, he's now opted in to downloading his immunization records automatically. Let's shift our attention momentarily now to Aggregator on the right. Aggregator is this piece of software that processes these immunization queries to the immunization registry and delivers them back as FHIR. Now, we're going to refresh Aggregator and display this recent request from Michael Freeman. There it is. And at that point, it tells us that this is in progress and being prepared. So very soon, Michael will be able to go back into his Medyear app, and he should be able to view his current Michigan status. Okay, let's do that now. There it is. This is your immunization forecast here, which has the next dose due and immunization successfully opted in, transmitted the information about the user to MyHIN, requested the immunization records, translated them into FHIR, and delivered them back to the user. Thanks a lot for watching our demo.
Okay, so that was a demo of a FHIR integration at the statewide level with something like 10 million patients available to us to be able to import their immunization records. We will also be able to publish the user's direct address to the state and request that records that flow through the state will end up in the patient's hands in their PHR portion of their Medyear app. So yeah, Medyear's looking forward to phase 2 of the challenge. We believe that FHIR is an important emerging standard. The reason I showed the video is to show you the complexity involved with something something at this scale. The ImmuGate exists because there is not a ready translation for certain things into FHIR. So we had to build it, and it's now something that the state will take forward and deploy, put into production so that it can actually translate these more legacy-style records into FHIR. But that goes to show you how much people around the country, particularly in places like Michigan, believe in FHIR, and so does Medyear. So thank you for this opportunity to present. Sorry for the technical glitches early on, but look forward to chatting more about it.
All right, thank you, Panya. Last up, but not least, we have Ken Foster from MetroStar Systems. And again, you can share our screen with us by going to the Share menu and clicking on My Screen.
And Ken, I just gave you the ball so you have full control. Perfect.
Got it. Are you able to hear me?
We are.
Excellent. And you see just a Windows background?
Yep, we do.
All right, let me go ahead and get started then.
Thank you.
So again, thank you all for the time today. I think I'll be very brief in the interest of time. My name is Ken Foster, and I'm the Director of Matrix Operations in MetroStar Systems. MetroStar is a company of about 200, does a lot of work with the federal government based out of Washington, D.C. And I'd like to talk briefly today about why we entered the challenge and the app that we have designed for the challenge. I'll start by just mentioning, first of all, though, that out of the 8 companies that won awards during the phase 1 of this consumer challenges and its counterpart, the Provider Health Challenge, 7 of them had health or med or wellness in their name, but MetroStar Systems does not. So that immediately, begs the question of what we're doing here, and I'd like to sort of share our thought process behind the challenge with the lowercase c, the bigger challenge of increasing adoption and integration of HIT. I'd like to start with an example. First of all, I'm sure many of you maybe still have these if you're issued one of them by your employer. This is the first generation Palm Pilot and not too old BlackBerry, of course. But I highly doubt that any of you have purchased one of these as your personal phone for the past few years. On the other hand, you probably recognize this as the first generation of the iPhone, which is ubiquitous. I bet at least half of those of you on the call today are using one of these. And the reason I bring this up is because the iPhone and the BlackBerry technically were not any different in 2006 when they first came out. They use practically the same underlying technology. The difference was in the user interface and the overall experience of the user. And in MetroStar Systems, we're not a health IT company solely, although we do work with HHS and NIH among other customers. But we are a user-centered design shop that focuses on creating apps, websites, etc., with optimal user experiences, and that's why we enter challenges like these to create products such as this to engage our users and hopefully change the world. So as I mentioned, this is an overview of MetroStar. And first of all, the question then becomes, why lock it and why now? and this is data that is very familiar, I'm sure, to many of you. But when you see that you have an increase of 50% or more in the use of EHR systems since 2012, coupled with the increasing prevalence and adoption of the FHIR standard, that gives you an opportunity for an economy of scope that wasn't available in the past. So that brings us to our idea, which is Lockit. And essentially, the basic idea behind it and the vision for it is combining Mint, which is a very successful financial app that I'm sure many of you use, with the existing systems, including integration using the FHIR standard. Mint, for those of you who don't know, allows you to log into your bank accounts, to your payroll data from work, to your investment accounts, to your credit cards, and aggregate everything in one place to give you actionable data and consolidated and easy-to-use data that you can use to manage your financial health. In this case, obviously, Lockit would be used to manage your physical health. Some concerns that we've taken into account are cross-platform support, so using a technology called Xamarin to make sure that we are able to easily support both iOS and Android, as well as Windows, and yes, even BlackBerry if that technology were to make a comeback. Obviously, as we know from the topic of the call today, we're working on the FHIR standard. And HIPAA compliance and security, of course, is a major concern for anything related to dealing with PHI. Here you have a few of the screenshots from our front end of the app submission. And on the other side here, you see there's also a provider-facing app that we are developing. Among the technologies that we use are easy transfer of records. So when you walk into your doctor's office for the first time, you're not either reciting from memory your prescriptions and health history, but it's actually carried on the phone and can be transferred via near-field communication from one phone to another. We use a secure messaging system. Obviously, you cannot communicate over email between providers and patients, one of the many pain points that technology could help. We have calendars, and we have additional features that are unique to providers. In terms of next steps, we are looking at working with local providers. So far, we have a partnership with a chiropractor, and we're looking to work with additional providers who tend to be in the same network of referrals in order to get a local critical mass to then obviously grow the technology. And additionally, of course, as everybody else on the call today, I'm sure, we're looking towards phase 2 of the challenge, due in a couple months as the potential next major milestone for us. So, pending any other questions or comments, that's what I have to present today. Thank you, everyone, again for your time.
All right. Thank you, Ken. So those were our 4 Phase 1 winners. I want to thank them all for dialing in and showing us what they have been and are working on. So Phase 2, which is open not just to our Phase 1 winners, but to anyone who participated in Phase 1 but did not win, and also to anyone who didn't participate in Phase 1 at all. Final submissions, their apps will be evaluated on these 4 criteria, the number, sources, and the types of data aggregation using FHIR, the functionality and quality, or the kind of technical implementation of the data aggregation, the privacy and security of patient data, and the user experience and visual appeal. So, of course, the submission period began as soon as we completed Phase 1. It closes on November 7th, and we will be having one more webinar a few weeks in advance of that end date. And then we anticipate announcing the winners in mid-December. I know we had previously stated specifically December 15th, but events will determine exactly when that will be. The awards for Phase 2 are $50,000 to the first place winner, $25,000 to the second place winner, and then an additional prize called the Ultimate Connector Prize, which will go to the app that connects the greatest number of unique pairs of EHR vendor system and provider using FHIR. and anyone, including the first or second place winner, can win this award. So if you have further questions about the winners, about Phase 1 or about Phase 2, about FHIR or the connecting and accelerating a FHIR app ecosystem, you can go to either of the direct links to the challenge that you see on your screen there, or just go to challenge.gov and search for FHIR or consumer or provider. Additionally, you can contact our webinar host, Josh, at the email at the bottom there, or myself at adam.wong@hhs.gov. So again, thanks to the participants on today's webinar and to all the people who dialed in this afternoon. We will be having a similar webinar about the Provider User Experience Challenge winners this Thursday from 3 o'clock to 4 o'clock Eastern. And you can find that at the challenge sites or email me if you need the link. Thank you very much, and have a good afternoon.